Are you feeling a bit under the weather? Or just looking for ways to boost your health as you navigate your 60s and beyond? It's a natural instinct to seek out ways to support our bodies, especially when we feel new aches. Notice our memory isn't quite as sharp, or just want to maintain our vitality. Many of us turn to supplements, thinking they're a safe, natural path to better health. After all, if it comes from a plant or is something your body naturally needs, how could it possibly be harmful? We see them advertised everywhere, hear testimonials from friends, and they promise everything from better sleep to sharper minds. It's easy to fall into the trap of believing that natural always equals safe, and that if a little is good, a lot must be even better. But here's the surprising truth that many people over 60 learn the hard way. Sometimes, what seems like a harmless supplement can actually be dangerous, especially when combined with your existing health conditions or medications. The painful reality is that without proper guidance, you could inadvertently be putting your health at risk, sometimes with serious consequences. In this video, we're going to uncover 3 common supplements that many people over 60 take without a second thought, but which you absolutely should discuss with your doctor before ever considering them. You might be shocked to learn just how risky some of these seemingly innocuous remedies can be. Watch to the end for something that will truly surprise you about how much control you can take over your health, simply by being informed. Let's dive right into the first supplement we need to talk about, one that's often lauded for its mood-boosting properties, St. John's wort. You might have seen it on the shelves, perhaps even considered it yourself, especially if you've been feeling a bit down or struggling with occasional low mood. It's widely known as a natural alternative for supporting emotional well-being. And it sounds appealing, doesn't it? Something derived from a plant, a natural way to lift your spirits. However, for those of us over 60, St. John's wort comes with a very serious caveat, particularly because many in our age group are managing multiple health conditions and, consequently, taking multiple prescription medications. This is where the real danger lies. St. John's wort isn't just a gentle herb. It's a potent substance that can have significant interactions with a wide array of prescription drugs, turning a seemingly helpful supplement into a real health hazard. One of the most critical interactions is with antidepressants. If you are taking selective serotonin reuptake inhibitors, or SSRIs, for depression, combining them with St. John's wort can lead to a dangerous condition called serotonin syndrome. This happens when there's too much serotonin in your brain, causing symptoms that can range from mild, like sweating and tremors, to severe, including fever, confusion, and even seizures. Imagine feeling increasingly agitated, experiencing rapid heartbeats, and suddenly realizing something is terribly wrong, all because a supplement you thought was helping clashed with your prescribed medication. It's a frightening thought, and it's a very real risk. Beyond antidepressants, St. John's wort can also interfere with blood thinners, like warfarin. If you're on a blood thinner to prevent clots, taking St. John's wort can actually reduce the effectiveness of your medication, potentially increasing your risk of dangerous blood clots, stroke, or heart attack. Think about it, you're trying to protect your heart, but unknowingly, a supplement could be undoing all that good work. It's like trying to fill a bucket with a hole in the bottom. The list of problematic interactions doesn't stop there. St. John's wort can also make certain heart medications, like digoxin, less effective, meaning your heart might not be getting the support it needs. It can interfere with some medications used to lower cholesterol, making them less potent. Even common medications for high blood pressure can be affected. For women, it can reduce the effectiveness of birth control pills. And if you're managing conditions like epilepsy, St. John's wort can actually lower the effectiveness of anti-seizure medications, potentially increasing your risk of seizures. The reason for these wide-ranging interactions is complex, but in simple terms, St. John's wort can speed up the rate at which your body processes and eliminates many common medications. This means the prescribed drugs don't stay in your system long enough to do their job properly, rendering them ineffective, almost as if you hadn't taken them at all. When you what should you do if you're considering St. John's wort? or if you're currently taking it first and foremost. Never ever start taking it without having a detailed conversation with your doctor. It's crucial to disclose every single supplement you're taking, or thinking of taking, alongside all your prescription medications. Your doctor needs the full picture to assess potential risks. If you're already on St. John's wort, do not suddenly stop your prescription medications to take it instead. This can be incredibly dangerous and lead to severe withdrawal symptoms or worsening of your underlying condition. Instead, talk to your doctor immediately about weaning off the supplement safely if it's deemed risky. Pay close attention to your body for any unusual symptoms after starting St. John's wort, especially if you're on other medications. Look for things like increased anxiety, rapid heart rate, unexplained bruising, or feeling like your regular medications aren't working as they should. Remember, while the promise of natural relief is appealing, the intricate chemistry of our bodies, especially as we age and potentially manage more health complexities, means that natural does not automatically mean safe when it comes to supplements. This first example really highlights how vital it is to have an open, honest conversation with your healthcare provider about everything you're putting into your body. So, while St. John's wort certainly demands our careful attention, it's not the only one that can cause unexpected trouble. Let's turn our focus now to another popular supplement, often taken with the best intentions, particularly by those looking to support their cognitive health as they age: ginkgo biloba. This extract from the leaves of the ginkgo tree has been used for centuries in traditional medicine and has gained widespread popularity in the Western world. You've probably seen it marketed as a brain booster or for memory support, and it's easy to see why it appeals to many people over 60 who are concerned about maintaining their mental sharpness. The idea of a natural way to keep your mind agile and improve blood flow, especially to the brain, sounds like a wonderful solution. But just like St. John's wort, ginkgo biloba is far from a harmless herbal remedy, especially for our age group, and it carries significant risks that absolutely must be discussed with your doctor. The primary concern with ginkgo biloba, and a reason it makes our list, is its well-documented blood-thinning properties. It can act as an anticoagulant, meaning it reduces the blood's ability to clot. Now, this might sound beneficial if you're worried about circulation, but it becomes incredibly dangerous if you're already taking prescription blood thinners, like warfarin, often prescribed after a stroke, heart attack, or for conditions like atrial fibrillation. The combination of ginkgo biloba with these medications can dramatically increase your risk of bleeding. Imagine a simple fall leading to a much more severe bruise, or even an internal hemorrhage that you're not even aware of. Or think about a minor cut that just won't stop bleeding. These are not hypothetical scenarios. They are very real dangers. Even common over-the-counter pain relievers like aspirin or ibuprofen, which also have blood-thinning effects, can compound this risk when taken with ginkgo. Many people regularly take a daily aspirin for heart health, completely unaware that adding ginkgo biloba to their regimen could be turning that protective measure into a hazardous combination. Furthermore, if you're scheduled for any kind of surgery, even a minor dental procedure, taking ginkgo biloba can significantly increase the risk of excessive bleeding during and after the operation. Surgeons and dentists always ask about medications, but people often forget to mention supplements because they don't view them as real medicine. However, failing to disclose ginkgo could lead to serious complications on the operating table, turning a routine procedure into an emergency. It's a critical piece of information that your healthcare team absolutely needs to know. Beyond bleeding risks, ginkgo biloba can also have other less common but still concerning side effects. Some individuals have reported digestive upset, headaches, and dizziness. More seriously, there have been rare reports of seizures in people taking ginkgo, particularly those with a history of epilepsy or other seizure disorders. While these instances are uncommon, they highlight that even natural substances can have powerful effects on the body's delicate systems. So, what action should you take regarding ginkgo biloba if you're currently taking it, or considering it for memory support? The most important step is to have a frank discussion with your doctor. Be especially vigilant if you are already on any form of blood thinner. Whether prescribed or over the counter, your doctor might suggest alternative, safer ways to support your cognitive health that don't carry the same bleeding risks. If surgery or a dental procedure is in your future, it is absolutely crucial to inform your doctor, surgeon, or dentist about your ginkgo biloba use well in advance. They will likely advise you to stop taking it for a specific period before the procedure to minimize bleeding risks. Never underestimate the importance of full disclosure. Your healthcare providers are there to help you, but they can only do so effectively when they have all the pieces of your health puzzle. Think of it like this. Your body's internal systems are complex, like a finely tuned orchestra. Adding a powerful ingredient like ginkgo biloba without understanding how it interacts with other instruments, or in this case, your medications, can throw the whole symphony into disarray. It's a powerful reminder that even supplements intended for good can have unintended and potentially dangerous consequences if not approached with caution and professional guidance. We've covered St. John's wort and ginkgo biloba, both of which highlight the critical importance of speaking with your doctor before adding anything new to your health regimen, especially as we get older and our bodies become more complex. But there's a third supplement that many of us take, thinking it's unequivocally good for us. Often without realizing, it can also have hidden dangers: high-dose omega-3 fatty acids, commonly found in fish oil supplements. Omega-3s are celebrated for their dose potential benefits to heart health, reducing inflammation, and even supporting brain function. And it's true, in appropriate amounts. Omega-3s can be incredibly beneficial. However, the key phrase here is high dose. And for those over 60, especially if you're managing existing health conditions or on certain medications, taking large amounts of omega-3s can tip the scales from helpful to harmful. Just like ginkgo biloba, one of the primary concerns with high-dose omega-3s is their potential to increase bleeding risk, while generally milder than the effects of prescription blood thinners. Large quantities of fish oil can have a significant anti-clotting effect. If you're already taking blood thinners such as warfarin, aspirin, clopidogrel, or even non-steroidal anti-inflammatory drugs like ibuprofen, adding high-dose omega-3s can amplify this effect, significantly increasing your risk of bruising, nosebleeds, or even more serious internal bleeding. Imagine taking a tumble and finding yourself with an unexpectedly severe bruise, or experiencing prolonged bleeding from a minor cut. These subtle changes can be red flags indicating a heightened bleeding risk. It's not just about obvious bleeding either. Internal bleeding can be silent and incredibly dangerous. Your doctor carefully balances your blood-thinning medication to achieve a specific level of protection. Adding a high dose of omega-3s without their knowledge can disrupt that delicate balance, pushing you into a zone where the risks outweigh the benefits. Another less commonly known interaction is with blood pressure medications. Omega-3s have been shown to slightly lower blood pressure. While this might sound like a good thing on its own, if you're already taking medications to manage high blood pressure, combining them with high-dose fish oil could lead to your blood pressure dropping too low. This can cause symptoms like dizziness, lightheadedness, and even fainting, increasing your risk of falls, which are a serious concern for older adults. Imagine standing up too quickly and feeling your head spin, or feeling persistently weak and unsteady on your feet. These could be signs that your blood pressure is lower than it should be, and your omega-3 supplement might be contributing to the problem. It's crucial that any changes to your blood pressure are managed under a doctor's care. Beyond interactions, high doses of omega-3s can also lead to unwanted side effects. The most common are digestive issues, like fishy burps, heartburn, nausea, and loose stools. While usually not severe, these can be quite uncomfortable and disrupt your daily life. Less frequently, very high doses of certain types of omega-3s have been observed to potentially increase levels of LDL cholesterol, sometimes referred to as bad cholesterol, in some individuals, which is counterproductive if you're taking them for heart health. Furthermore, not all fish oil supplements are created equal. Some lower quality products may contain contaminants like mercury or PCBs, which are certainly not something you want to be adding to your body, especially over the long term. This is why checking for third-party certifications for purity and potency is so important if you do take them. So, with high-dose omega-3s, the message is similar but perhaps even more surprising because these supplements are so widely praised. Before reaching for that extra large bottle of fish oil, talk to your doctor. Discuss your current medications, especially any blood thinners or blood pressure medications. Your doctor can help you determine if the benefits outweigh the risks for your individual health profile and advise on an appropriate dosage. Or if you should get your omega-3s from dietary sources like fatty fish a few times a week, which is often the safest and most effective approach. They can also guide you on reputable brands and proper dosing. The goal isn't to scare you away from all supplements, but to empower you with knowledge. In summary, we've walked through 3 supplements: St. John's wort, ginkgo biloba, and high-dose omega-3s that, while widely available and seemingly beneficial, carry significant risks for those of us over 60, especially due to their potential interactions with common medications and existing health conditions. These examples clearly demonstrate that natural doesn't always mean safe, and that every substance you put into your body, whether a prescription drug or a supplement, has the potential for powerful effects. Your health is unique, and what might be safe for one person could be dangerous for another. The surprising truth you learned is that your greatest protection comes from open communication with your healthcare provider. They are your most valuable resource in navigating the complex world of health and wellness, helping you make informed decisions that genuinely support your well-being. Remember, small changes and informed decisions can make a world of difference to your health and happiness as you age. Taking a few moments to talk to your doctor about any supplement you're considering is not just a good idea. It's an essential step in protecting yourself and ensuring you live your best. Healthiest life. What are your thoughts on these supplements? Have you ever had an unexpected interaction? Share your experiences and questions in the comments below. Your insights could help someone else. If you found this information helpful, please give this video a thumbs up and subscribe to our channel for more practical advice and empowering content designed just for you. Live your best life at every age.